Hi, I'm Julie Wentworth. I'm going to be your personal trainer. What's your name?
My name's Evelina Wentworth. Nice to meet you.
Nice to meet you. Let's have a seat. Before we get started, I just wanted to thank you for being in this video and let you know that this is only going to my professor as an assignment, and I wanted to ask your consent for that.
Yes,
Okay.
you have my consent.
Thank you. All right, so what I'm going to have you do first is fill out your full name, date of birth, your emergency contact, and your primary care provider.
Okay. Okay.
All right, thank you. And then why are you coming to me today?
Well, I used to be a runner, but I've been experiencing pain, so I had an MRI, and they told me that I had a root meniscus tear.
Okay. Have you done anything since that MRI?
I just basically have cut out running. I do minimal work, like machines at the gym. But I do walk. I continue to walk.
Did you see a physical therapist for this issue?
No, I did not.
No. Okay. Did you tell your physician?
No.
No. Okay. So it doesn't affect your daily life that much. You're not taking any medications for it?
No.
Okay. In the past 12 months, have you experienced any hospitalization or surgery, major injury or accident, any illness or new prescription medications or changes in mental health?
No.
No. Okay. Do you have any of these chronic conditions? Just let me know if there's a yes.
No.
No. Are you currently taking any medications for any issues or anything?
I just take a daily vitamin.
All right, that's awesome. And then I just have a PARQ, basically just a physical activity readiness questionnaire. If you want to fill this out, let me know if there's any yeses.
No.
Okay. And then I just wanted to ask you some questions about your lifestyle and physical activity. Do you smoke, vape, alcohol, tobacco, any of that in use?
No.
No. All right. How would you say you sleep?
I usually get about 7 to 9 hours of sleep.
All right, excellent. Are you eating well?
Yes.
Yes. How would you describe your current physical activity?
I definitely am an active person, but I'd like to incorporate more weight resistant into my workouts.
Okay. And how many days per week would you say that you exercise, and what are you doing?
I walk at least twice a week, maybe 3 times a week. And then, like I said, I need to incorporate weight resistance more.
Got it. And do you experience any pain during these walks that you've been going on?
No.
No. Any family medical history that is chronic, such as heart disease, stroke, diabetes, high blood pressure, cancer?
No.
No. Okay. Do you have any specific health and wellness goals, or just increase strength and get back to your running?
Yeah, I would definitely like to add more muscle, just because I feel like I've always been kind of toned, and now I'm really definitely lost muscle.
Okay.
But yeah, maybe more flexibility just to prevent anything, any injuries.
All right, and then I'm going to have you fill out this ROS. It's basically just going through each system in the body. These are different symptoms that can occur in these systems. It just kind of lets us know if something is wrong. Just let me know if any of these are circled, and then we can move on from there.
Okay. I do have some joint pain, especially in my hands, that I wanted to go and probably go to a doctor to look at.
Okay, so your doctor's not aware?
No.
Okay. Yeah, that would be something that you would ask your doctor about before we maybe start working on resistance training just with holding weights, but I'll definitely keep that in mind when we start programming.
Okay.
All right, and then next is going to be this Tampa scale for kinesiophobia. I'm going to have you fill this out. Just let me know if any of these are a concern for you. No.
No.
Okay.
I've never had these thoughts.
All right. Well, before we would start doing your training, I would just take your heart rate and blood pressure, but we're not going to do that today since we're just taking your medical history. But I would just want to get some resting measures. And then what would you say your current attitude toward exercise would be? Like, are you ready to get started? Are you not quite sure? This just gives me an idea of like your experience with exercise and how comfortable you feel with it.
I am comfortable exercising. I've been exercising for a very long time. I just don't make the time. I'm hoping with summer coming, and that's my break time, that I will incorporate it more, but I don't have fear of exercise.
All right. And then
or gyms.
Okay. Now I would test your range of motion, strength, and specialized test. We're not going to film that though. And I would do that with active range of motion and passive range of motion, as well as manual resistance. And then how long did you want it to take for you to get back to running? What would be your timeline?
Well, like I said, I have the summer available to me, so that's about 10 weeks. And I don't know that I would go back to running the lengths that I used to run, but like now I don't run at all. So I would think it would be reasonable to say about 10 weeks.
Okay. Yeah, that would work. Before we get started, I just wanted to educate you on just injury prevention with meniscus tears and what we can do to strengthen that. And then I would give you an exercise prescription after our first session. Just based off how that session goes, I can just give you some workouts to do at home. And then again, make sure you get that joint pain checked out and get back to me on that. And then we're all set. Thank you so much. It was very nice meeting you.
Very nice meeting you. Thank you.
After doing my first interview, I feel that it went well. The client was just a little confused on the Tampa scale at first, but other than that, I got a good baseline of where the client was at physically and what they would like to improve upon, which helped me for knowing what their program would be and how I would move forward. I feel that I did good on asking follow-up questions based on their open-ended responses, and then I had a full understanding of the client's lifeline and their goals. I feel like our eye contact was good and that the conversation flowed well. What I thought I could improve upon is my lack of relying on the form. I feel like I used the form a lot during this interview and really focused on what came next, which is why I use the word a lot as a filler word. So I feel like I could have had smoother transitions between questions that I was asking. I also feel like it took a long time because during my video I was having the person fill out the form instead of doing it beforehand and then asking follow-up questions, but I think that was just due to my lack of understanding of the assignment and not knowing how to make it flow smoothly. The first patient mentioned that they had a root meniscus tear due to running. For my 6 lines of thoughts for psychosocial, I thought that this could have a impact on their emotions and their motivation to run again because of the injury and pain. After having this injury, it's kind of hard to get back into running, especially because she chose not to have a surgery, so it's not necessarily healing on its own, and that could have her have a lack of motivation to start running again. For assessments, I think I would do strength testing using manual resistance for her glutes and quads. And this could be because if her quads or glutes are weak, there would be abnormal knee loading patterns, which would cause this root tear meniscus. The diagnosis was a root tear of the meniscus due to weak quad strength in the injured leg, and my prognosis would be to rest right after that happened, but because they didn't get surgery, just continuing to strengthen them and try to do this so that they could decrease their joint degeneration in their knee with more running. For their interventions, I would give them a resistance training program focusing on lower body strength and kind of giving them more options into less impact cardio, because it's not like this injury will go away, and just continuing to load running would continue to put more stress on the joint. The outcome, though, is that the patient can return to running as long as pain is not induced, and that due to gains in strength and glutes, they should be back into full shape to continue with all exercise. Hi, I'm Julie.
Hi, I'm Chris.
Right, we can have a seat. Before we get started, I just wanted to let you know that this video is for an assignment and it's going to my professor only, and I just wanted to get your consent for this video.
You have my consent. Do I have your consent to give you a Google review?
Yes. Alright, so what's your reason for visiting me today?
My reason, Julie, for coming to see you today is I'm an ex-college baseball player, and I've got a banged up shoulder, and I've lost like 40 pounds, and I heard you were the best trainer in Estero at helping restore function and help me getting back on the golf course.
Alright, sounds good. We can get you to that level again. So before we get started, I just need to check your current medical status. In the past year, have you had hospitalization or surgery, a major injury or accident, any acute illness, or changes in mental health?
Well, I have 2 daughters, but no changes in mental health. As I said, I'm an ex-college baseball player, and I was in a severe car accident, so I have a degenerative arthritic shoulder that I'm too young to get replaced, and I had a disc replacement in 2019 at C5 and C6.
Okay.
But I'm currently working out now, and I've currently hit a plateau in my current program.
Got it. So this wasn't in the past 12 months?
No, it's been a lifetime.
Okay. Your physician's aware and you're cleared for all physical activity, though?
Of course.
Yes.
I do an annual wellness exam twice a year.
All right. Do you have any of the following conditions? Heart disease, high blood pressure, high cholesterol, diabetes, asthma, bone joint problems, neurological disorder, or cancer?
I have a bone and joint disorder. I have glenohumeral arthritis in my left shoulder.
Okay. Have you seen a PT for this problem?
In fact, I did today.
Okay.
FGCU alumni, Dr. Matt Tumbarella.
So for me, you just want me to get your functional strength back?
Continue to get my functional strength back and help me be strong when I play golf so I don't get hurt.
Are you taking any medications?
Of course.
Want to list them for me?
I am taking a statin, and for my calcium score, not because I have not because my cholesterol's bad. And then I take a baby aspirin daily, once again, as a preventative measure. And then once in a while, some allergy medicine.
But these have never affected your exercise?
No.
Okay. I'm going to have you read this Part Q and let me know if you have any yeses.
No. 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 Yes, Julie, I do have bone and joint soft tissue issues in my left shoulder. I have limited external rotation, and sometimes my infraspinatus flares up a little bit.
Okay. Any lifestyle, smoking, vaping, alcohol, tobacco use?
I have never smoked, vaped, and have not touched a sip of alcohol since 4th of July, 2023.
Alright. How would you say your sleep quality is?
You know, I'm in a high pressure job and have 2 daughters, so I would say it's good, but it could be better.
Alright, and your nutrition?
I am spot on. I've gone from 259 pounds down to 219 pounds in 4 months. I eat a balanced diet, mostly plants, and I make sure I consume adequate protein intake.
Got it. That's awesome. How many days per week do you exercise?
7.
7. And then what do you regularly do?
Well, on Mondays I do an upper body. Wednesdays do I lower body. Friday I do a private Pilates, and then I do an after dinner walk every night and 20 to 60 minutes of cardio every day.
Got it. Do you experience any pain when doing any of those activities?
I modify my workout based upon my left shoulder.
So, I know we went over your medical history, but do you have any family medical history that I should know about, chronic diseases?
Well, my dad and grandfather died of dementia,
Okay.
and my mom's a train wreck as a result of smoking. She has a pacemaker and a defibrillator.
Okay, so nothing that would affect you
No,
directly.
I just had a
exercise.
physical. My biological age is 8.5 years younger than my birth age. I'm a picture of health, Juliana.
Okay, I had you fill out your ROS. See that you circled joint pain for musculoskeletal issues. Is your physician aware of this?
Yes.
Has it worsened since the last time you've seen them?
No.
Do you know the cause of this? Is it only in your shoulder?
The cause is a lifetime of football, baseball, and flipping a car off a tree in a car crash.
Okay.
As you know, I'm a Brazilian Jiu-Jitsu blue belt also,
Yes.
and participated in CrossFit and Muay Thai. So that could all lend to my condition in my early 50s.
Yep. Your kinesiophobia scale looks good. I take your objective measures before we would start our first session, and then last but not least, what would you describe your current attitude towards exercise?
Exceptional. I'm ready to go. Let's go.
Okay.
LFG,
Well, thank you so much
Julie.
for meeting with me today. I look forward to our first session.
Thank you, Juliana.
After taking the second client's medical history, I feel that my timing was more efficient than the first time I had done it. I was able to cut off 3 minutes, whether that be because I had the client fill out the ROS and Part Q before I took their interview, or because I was just better at taking the information. I think it was a good client to use because of his injury. I feel that a lot of older clients would have arthritis. I feel like the client was very engaged and had good results, good responses, which helped me with practicing. I feel like what went wrong was I noticed that my form had multiple redundancies of joint pain, so I just crossed it off for one of the medical conditions since it's on ROS. I also said a lot. I think it was just because I was nervous for my client. Using my parents as a client was kind of hard for me just because I just felt uncomfortable, but that's just me. I think I had weak responses to his open-ended questions sometimes because I, for example, didn't know what to say to his medications. He listed off a few and I just didn't know how to respond. And then I didn't really say anything after he said he had participated in physical therapy. Moving on to his 6 lines of thoughts for quality of life, I think that his psychosocial, that would be his issue because he might have some difficulty with performing daily tasks, which can affect his confidence and his reliability on himself. For his assessments, I would assess his range of motion because I know with arthritis, especially in the shoulder, there can be lack of external rotation and abduction. His diagnosis is glenohumeral arthritis due to AC joint reconstruction in the past, which led to limited flexibility within the joint. His prognosis is that this is a progressive condition and it will likely worsen over time if it's untreated. Due to the patient being a young age, he has not gotten shoulder replacement surgery yet, but he probably will have to because of joint degeneration. But because of this, there will be increased pain and loss of function until he gets this surgery. So this is why I would need to do an exercise prescription with strength as well as mobility, trying to gain that range of motion. For his intervention, I would focus on maintaining his range of motion and strengthening all of the muscles around the scapula and rotator cuff muscles, and then also work on posture control, knowing that the shoulder has a factor in that. And then his outcome would be to increase overall shoulder flexibility and strength of the rotator cuff muscles. Hi, I'm Julie Wentworth.
Hi, I'm Jackie.
Nice to meet you.
Nice to
Have
meet
a
you too.
seat. Before we get started, I just wanted to let you know that this video is going to my teacher and my teacher only, and I just needed to get your consent before we started.
Yes, that's it. You have my consent.
Okay, thank you. I see you filled out all your client information in your primary care provider. Thank you so much for that. Before we get started, I just wanted to know your main reason for coming to work with me.
I'm a cross-country runner, and I also do distance running, and I just wanted to strengthen my legs to overall improve my cross-country times.
Okay, sounds good. And you're in off-season right now?
Yes.
When does your season start?
It starts in August.
I see that you checked that you had an injury in the past 12 months. Can you explain that to me?
I had 5 months ago IT band tendonitis, and while I ran, it would hurt my knee, but yeah.
What would you say that pain felt like? Like, could you describe it to me?
It felt like, I didn't really feel it like where I know it is. I felt it like in my knee, and it was like just like a pinching kind of while I ran.
Okay. Has it happened anytime since you've been running in the past 5 months?
No, not really.
Okay. So your physician cleared you to run again. Did you see them?
Yes.
Yes. Okay. Has it gotten worse since the last time you've seen them?
No.
No. And would you say you have any limitations in your exercise now? You're able to do everything?
Yeah. I just want to strengthen my legs.
Okay. I see that you checked no for all your ongoing medical history. That's good. No major conditions. Are you on any medications?
No.
And I see that you also checked no for all of the Part Q questions. Next, I just wanted to ask you about your lifestyle and physical activity just to get an idea of your training age. No smoking, vaping, alcohol use, tobacco use?
No.
Okay, good. How would you say you sleep?
I think I sleep pretty well. I try to get like 7 to 8 hours of sleep.
That's good. How would you say your nutrition is?
It's good. It probably could be better, but it's good.
Okay, during season, would you say it's better?
Yes.
Okay, that's good. What about your stress levels? Do you think you have high stress?
Yes.
Yes.
Yep.
Do you think that has an effect on any activity?
No.
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 Just stressed out.
Yep.
Okay. How would you describe your current physical activity level?
I've been getting back into season, so I've been running every day or trying to run every day.
Okay. And how many days per week every day?
Pretty much every day.
Okay. And then besides running, do you do any other forms of exercise?
I like to go on walks, but that's it.
Okay. And then do you experience any pain or discomfort during any of those activities?
No.
Do you have any medical history of chronic conditions in your immediate family, such as heart disease, stroke, diabetes, high blood pressure, or cancer?
No.
And then, besides strengthening, do you have any specific current goals for me?
Like my times or just what you could do?
Yeah, like what you want to focus on.
Well, anything to make me faster, so I think that would be like leg strength, arm strength, help with form, just like strength in general.
Okay, that's good. I see you filled out your ROS. Nothing circled besides joint pain. I think that's just in your knee.
Yeah.
But you said you haven't had any pain recently, so you just circled it because of the past.
Yeah, I mean, I think running every day, you feel overworked, so you have to like stretch a bunch, but you know,
Yeah.
it's like little stuff.
That's good. You've been stretching though when you feel pain.
Yes.
Anything else you do, like icing or anything?
Yes.
You ice.
Yeah.
Does that usually help?
Yes.
Your Tampa scale looks good. And then before we get started, what do you think best describes your current attitude towards exercise?
Where? Oh, up here. Like what I do now.
Yeah,
Maintenance.
Like maintenance.
Maintenance, yeah.
Okay, so you just want to maintain where you're at /
Yeah.
get better.
Yes.
Okay, well, for our first session, we would do some testing on your range of motion and strength just to see a baseline of where you're at, and then we'd probably do it at your last session as well to see if you've improved. But thank you so much for meeting with me, and I look forward to working with you.
Thank you. I'm excited too. Nice meeting you.
After taking the third client's medical history, I felt that my follow-up questions were better overall, and I felt that the interview moved more smoother. My timing of the entire history was less than the first two, so efficiency definitely played a factor. I think I had better transitions between questions and really focused on using the word less. What went wrong was I still was not fully comfortable with the flow of the form and relied still on the form in front of me instead of using my brain. I think the client kind of did struggle to understand some of the questions, such as like stress. Like I just asked her if she has high stress, which she said she did, and then I asked her how that related to exercise, but she didn't really have like a great answer for that, just because I don't think she knew. But I think that's just because of her lack of knowledge with questionnaires. She is under the age of 18, and usually parents help with those kind of things. And then she did tell me that she experienced some pain, but because this was an injury in the past, she said that she felt pain when the injury had happened, and I asked her to describe the feeling of the pain, but I forgot to ask her. She told me where it was as well, but I forgot to ask her how long it had happened for and how long it's been happening for. But she said she did not have pain now, so I feel like that's why I didn't ask that. But usually when someone mentions pain, you ask the 4 questions. For her 6 lines of thoughts, for her psychosocial, I said she could have a fear of reoccurrence. She had IT band tendinitis, and this happened due to overload of running. She runs a lot. She's a cross-country athlete, so she could definitely have that fear of reoccurrence, which may have her stop running and maybe have her over rest, which would decrease her performance overall. Her assessment, I wanted to test if her TFL was short because that increases tension on the IT band. I would test her glute medius strength because if that was weak, that would also increase the tension on the IT band and would cause her to have Trendelenburg gait. And then also she could have a leg length discrepancy. That would be another hypothesis, which would cause more impact and lateral stress on her IT band. Her diagnosis was that she had an IT band tendonitis due to short TFL, and her prognosis would be that she could return back to activity within 4 to 8 weeks after completing a strength program and flexibility. For her intervention, definitely a lot of foam rolling to release the tissues on the IT band and quads and glutes, as well as stretching the TFL glutes and IT band. Yeah, I already said that. For strengthening, she would strengthen her glute medius and her core as well as her hip abductors. Her outcome would be a full recovery with prevention of reoccurrence if her biomechanics and gait were fixed and her strength is maintained. And then just working on not overworking and putting constant load on the joints. I've noticed after all 3 medical histories that my confidence is growing with each client interaction, but I'm still lacking in my improvement of flow and my unnecessary transition words. I will continue to practice and use my form on other clients to prepare for the practical, and I will have my clients give me different types of medical conditions and injuries so that I can create hypothesis based on that. I also want to work on creating that form in my head instead of relying on the paper in front of me. So I think doing more runs without the form at all would help me to memorize kind of the order and the flow, so I wouldn't just rely on the paper in front of me, which I did use in all 3 videos because I was taking medical history, but for future use, do it without the form. And that's it.